Well, it is one of the most dreaded diagnoses. The word cancer strikes fear in any patient undergoing screening. A research panel at the National Institutes of Health suggests some patients, though, are being unnecessarily frightened. KITV4's Pamela Young joining us now to explain what I wouldn't have thought this is possible, renaming cancer, but there's a movement now to do so.
Absolutely. It's not a new word. It was Hippocrates, the father of medicine, who named the disease. He thought tumors found in his patients looked like crabs. The Latin word for crab is cancer.
Okay, hold real still.
Since then, science has labeled nearly every condition showing abnormal cell growth as cancer.
Cancer is the growth of cells who start growing and do not stop growing.
But modern technological advances in screening have caught many of these abnormalities before rampant cell growth. Ductal carcinoma in situ, also known as stage 0 breast cancer, is one of the conditions the National Institutes of Health says should be renamed because this cancer has not grown. But some oncologists say it's better to err on the side of caution.
I think the problem is that we still can't be 100% sure who is going to have, in addition to the ductal carcinoma in situ, invasive cancer.
1 out of every 5 breast cancers is ductal carcinoma in situ. A name change may lessen the emotional trauma for patients, but Dr. Carney says treatment would remain the same. The name change movement has found some success. Stage 0 cervical cancer, or cervical carcinoma in situ, is now called cervical intraepithelial neoplasia, thereby removing the cancer connotation. What concerns some oncologists the most is the effect on cancer research. A name change would affect some statistics, and that might affect cancer funding.
There's been a shortage of funding nationally, and it is a really detriment to our patients.
I'm not sure that changing name to something is going to do anything to the disease. Cancer is cancer.
There's also a move to rename certain prostate cancers. And as someone who has been diagnosed with ductal carcinoma in situ, I'm glad that my oncologist called it cancer and recommended aggressive treatment.
This is still really interesting, though, because I'm guessing a lot of people haven't even heard of stage 0 cancer.
And that's why some physicians are saying stage 0 might not be considered a true cancer. But I'm glad that my oncologist did call it cancer.
Important discussion. All right, thanks a lot, Pam.
Thanks.